Okay, everyone can hear me. Ooh, it's super loud, huh? Super loud and super important. I am Marshall Olson. I need to read this little disclaimer and then we'll get to the cool stuff. I do not have a financial interest of any product in my talk with any company offering grant monies for this continuing dental and medical education program. First of all, how many of you are from not Texas that are here right now? Who thinks they're from the farthest away from Texas? Where are you from? New Jersey? Alaska? All right, let's vote. Who thinks Alaska is farther away from Texas than New Jersey? Alaska? Think Alaska? Yeah. So, for being from the farthest away, I need you to pick something. I need you to pick blue, black, gray, or coffee. You're picking black. All right. You guys didn't know this was a participatory meeting or speech. So what you get for picking black is a shirt that says Texas. So you can do whatever you want with it, but no, we would never admit that. We would never admit that we're the second to anything. So I'm a general dentist here in Texas, but I wanted to talk about vitality in the socket and ridge preservation when you're doing extractions, because it seems like we do a lot of extractions as in the practice I'm in. You guys can read this as well if you want, but I like the definition of that it's the power of giving continuance of life, and vitality has to be present if something's to be considered living. And so in dentistry, we're always trying to keep things alive, right? We want the pulp alive, we want the tooth to stay alive, the tissues, we need more oxygen. And so, especially after something as traumatic as an extraction. This is from the IAOMT. This is their paper on cavitations or jawbone osteonecrosis. And down here, the whole point of that is that when there's less or reduced vitality, and that's when we run into problems later with that. So what do we do as dentists to keep this vitality going? We've probably heard a lot of lectures already. Ozone, PRF, Dr. Ganatri this morning, right? Talked about PRF, solid PRF. Grafting materials, lasers. This picture up here, this is the Tenet biomodulator, and they're here down in the corner. That's a really cool device that we use in our practice to help people recover. It uses frequency to increase oxygenation and vitality. So after surgery, we'll set people up with their machine, and it does a really good job with pain management. In conjunction with ozone and PRF. So I just wanted to go through a couple of cases, essentially, that we've done recently to just show you kind of what we do. I'm not saying you have to do it like I do. I know we're all dentists and we want to do it our way, but where we've found success with keeping vitality or the socket alive. So this is just after an extraction. This was actually done by my associate, Dr. Lee, in our office in Coppell. And so immediate placement of the implant, get some stability, and then this is PRP, or the fluid from the PRF, and then we're mixing in this granule that I think is pretty cool. That's what I want to talk about. It's a grafting material to give us a little more stability around our implant, and then placing it into here. And in this picture, I want you to pay attention to how wet the material is. It'll make sense in a moment. And then solid PRF placed around it, packed in on the buckle, and then left essentially open to recover. So this is the material. I don't get paid by them, but when I started using it, I thought it was really cool. And the reason I liked it is that, one, it's synthetic. I'm not putting cadaver bone. I'm not putting bovine or anything like that. It's hydroxyapatite and beta-tricalcium phosphate. But the design of it is honeycomb-shaped, which is what the design is in the human trabecula, and that's the inroad is this product. So the shape is very similar to the human bone. And with this porous structure, we have primary, secondary, and tertiary channels that would allow blood flow or blood vessel innervation into your graft material. So we're not just putting a chunk of something in there to help hold the implant or keep the sock. So the ridge looks nice with bone gingival coverage on there. We're also getting blood flow into the area. So again, the advantages of that material: synthetic, multiporous structure, and then an easy to fill. This is the whole idea. We want this vitality to go and move us all the way to bone regeneration. So quick break. I need you to write down the name or remember this name. I need you to remember Stuart Price. All right, this is in your slides as well. This is basically the description of it with the hydroxyapatite beta-tricalcium phosphate. How many of you use a grafting material, like a ridge preservation material? Along with PRF or by itself or just PRF? So this is another case. This was a full ridge removal of teeth, clean out. Obviously, this stuff, this case was done in Korea. The T-cell fibulin glue is not FDA approved. But this is 7 days after surgery, 2 weeks after surgery. And then this is what I liked about this grafting material is this video just piercing through the fibulin glue into the bone material, the graft material that was mixed with PRF. We're getting bleeding. So that means we have circulation into there, and then this is post-surgery, going in to check the hardness of the ridge. Intense, right? Good thing we've all done that before. But this is 28 days post-surgery, same situation. So we get good healing. Yeah, I'd love mine to look like that sometimes. But what the key there is that we had blood flow into the area. So the vitality, that's our whole goal, right? We want circulation. Circulation means more oxygen. Circulation means all our good stuff's getting there. And we're giving the body what it needs to finish and heal. This is a core sample from a similar, from that same case actually, before implant placement. The blue is the graft material. All the gray or brownish colored material is new bone formation in the core where we're going to place the new implant. So we know we're getting bone formation, but why are we getting good bone formation? Why are we getting good healing in the area? And it really is the blood flow into the socket. And what we're using is capillary action. That honeycombed pattern with the primary, secondary, tertiary channels. Gives us this capillary action within the graft material. So this is, again, a microscopic analysis of the extraction or the core. And here, we have blood vessel formation. Red blood cells in our graft. So that means we can get actually new bone formation there. There's our little inroad or the little micro-channeling of the graft material. So pretty cool. So I got another name for you to write down. The second name is Christian Zell. So because of the capillary action in this graft material, what we're able to do is we place the graft if we need it, and we get immediate capillary action, so pulling the blood. So generally if I'm going to use the graft material in an extraction, I'm going to extract the tooth, we clean it, we're using ozone, getting everything to nice and bloody in there, right? Then if we add the material, as opposed to it just sitting on top or chunking in, we're getting blood flow through the material because of those extra channels, which is going to just increase healing. So another case, fractured tooth, number 4. Tooth extraction. Anyone know what this is? Ozone, yeah. Implants placed. So in some cases, if we have enough stability, we would just pack it in with PRF and say, let's go, right? But when we want a little additional support, or we want to make sure we're supporting that ridge and that buccal plate a little bit more, then we'll mix the inroad, place it into the defect there, get that same wetting action from the capillary action. Very easy to manipulate. It's not falling out everywhere. And then PRF getting placed in there, especially along the buccal. And then, like Dr. Ganatri talked about, leaving it kind of open for an open healing process. And this is immediately after placement, just checking it out to make sure we're in a happy place. Another name for you. Anyone have an idea why I'm giving you these names yet? No? Okay. I want you to call these people. It might start getting easier. Next name I want you to write down is Philip Sherman. Philip Sherman. What was that? So because we have this extra, these are just the reference articles for the studies with the material. But the biggest thing that I've found with the vitality in the socket is if I can get the blood flow into the graft material with the PRF, and I use the tendon biomodulator after, I'm not having a lot of pain phone calls later, right? Like, hey, I'm sore, hey, I'm uncomfortable. And at post-op visits, we're seeing very little, like that case with the full arch, we're seeing very little swelling and a lot of healing because we have so much blood flow through the area. How many of you like the post-op call that's like, what'd you do to me? You told me this was a good idea. So third name, fourth name, right? Fourth name is Orrin Cervello. Scrivello is Scrivello. So this is my information. It's in there. So if you will email me, I'll get your email from you. I'll get you an answer to your question. So who knew that they were dentists? Who? You in the back? You have gray or coffee? Gray? So you get the gray Texas shirt. Yeah, thanks.